Hi, I'm Dr. Giles, a pediatrician here in Las Vegas. I started this channel to give parents practical and trustworthy advice, the kind of advice that I give to my patients every day here in clinic. Now, in the fall and winter seasons, a fever is usually the first sign that our child's immune system is working to fight off a virus. You've probably heard of some of these viruses: COVID, flu, RSV, but there are many other viruses that can cause these common cold symptoms. Now, typical symptoms: you're going to have a fever, also a runny nose, cough, congestion, and then sometimes you may even feel loss of appetite, body aches, headaches, fatigue, even vomiting and diarrhea. So what do you do then when your child has these symptoms? Well, the first thing is to understand how long a virus will last. Most viruses get worse in the first 3 to 5 days, and these symptoms will get worse in that time. And then over the next week, they generally get better. Even the fever can last up to 5 days and still be part of a viral infection. So then what do we recommend for treatment? Well, the treatment really focuses on the symptoms of your child. For fever, use Tylenol or Motrin. It's a great way to reduce the fever, help with body aches, headaches, and kind of really help the general uckiness of feeling sick. Then you can use home remedies. Home remedies include humidifier, nasal saline, suctioning, and for your older kids, you can even do things like sinus rinses, honey, teas, vapor rub, anything that'll help your child feel a little bit better. And of course, the most important, tender love and care. So the next question is, what about going to the doctor or the ER? Well, for your doctor's office, if the fever has been going on for 5 days or more, that's a great time to come see your doctor. Also, if you're worried about an ear infection, they're pulling at their ears, they're saying it hurts, that's a great reason to come see us, even before the 5 days. And of course, if your parent intuition, your gut tells you that something's wrong, come see us. We love to see your children, even if it's just to say, yeah, it's still a viral infection. Now, going to the ER, there are 2 main things that we look out for. The first is that your child is well hydrated. A well-hydrated baby is going to produce 3 or more wet diapers a day. When they cry, they're going to have tears, and generally their lips are going to be well hydrated. The other thing that we look out for is their breathing. If your child starts breathing and you can see their ribs going in and out, if you can see them tugging in at their throat, if they're working harder, yeah, that's a good sign that your child's working hard to breathe, and we should get them evaluated. Now, a question that I get a lot is, how high is too high of a fever? Well, this question has a little bit more nuance to it. A general rule of thumb: if your child is well hydrated, they will not get too high of a fever. Now, that being said, there are a couple of viruses that can cause a high fever. The flu can give high fevers and can be very alarming when looking at it. But mainly, we're going to look at your child. Are they drinking well? Are they breathing well? Is all this going well? Then you're going to be okay. Now, that being said, here's where the nuance comes in. If your child has a persistent fever, despite use of Tylenol or Motrin, then maybe you should go and get them checked out. Also, if they have seizure-like activity, that's not normal. You should go and get them evaluated. Now, I hope this helped you feel a little bit more confident in treating your child when they have a cold and fever, and to know when to go to the doctor's office or the ER. Remember, most fevers are just the body fighting off a viral infection. But if you're having dehydration problems, breathing problems, that's a great time to go in, see your doctor, and get reevaluated. Stay healthy. I'll see you next time.